Hello viewers, today we will discuss another evidence-based clinical case of a 10-year-old child who presented with the weakness of his left hand. Basically what happened to this child that he developed fever, and for that he visited his local health facility, and where a paramedic staff used some injectable therapy to treat the patient. Although his fever was relieved, but after injection he developed the weakness of his left hand, and he again visited the healthcare provider to tell him about his weakness, but he reassured him that it's not a big issue and that will be relieved in few days. But after 3 weeks, he did not feel any improvement in the weakness, and today he visited me. And when I examined this child, there was the weakness of his wrist area and the small muscles of the hands. Basically what happens to this patient that when paramedic staff use some injection, he selected wrong site for the injection, and that led to some radial nerve injury in the upper limb. And basically radial nerve supply the small muscles of the hands and the wrist, and when it damaged due to any reason, that can be the pressure, that can be some trauma, or that can be due to some injectable treatment, intramuscular, then there will be the weakness of the wrist area and the small muscles of the hand. Patient can elevate his limb, but there will be the drop of the wrist, and also the patient will not be able to open his fist, or unable to properly extend the fingers of his hands. How we can prevent this type of the lesion? The only thing is that we have to educate the patient as well as educate the paramedical staff he used to treat the patient, as advised by the physician or doctor under whom they are working, or if they are working independently in the periphery area, then they must know regarding the selection of the site for the injection, either in the limbs or buttocks, because a small mistake can lead to the big loss. Usually patient did not improve in the life, but sometimes there can be the improvement of, if the patient reported early to the specialist, then there can be the improvement with the help of splints, physiotherapy, nerve stimulation. All these can lead to the partial improvement of the symptoms and signs of the patient. The take home message is never go to untrained or non-qualified persons for your medical problems. Always choose the right place for the right treatment. If you will not do so, then you can face a problem that can be the small one, that can be the big one, and even a lifetime disability can develop, just like in this boy. Thanks for watching, and don't leave without LSCS.